This is Jessica DeMassa in the Guidewell Insights Lounge here at Singularity University's Exponential Medicine. I'm joined by Nittin Mittal, and he is a principal at Deloitte. So tell us what you do. What area of healthcare do you consult in for Deloitte?
So I lead the Life Sciences Healthcare Analytics book of business for Deloitte Consulting, and that includes everything that we do from a information management perspective, as well as pushing the envelope as it relates to artificial intelligence, cognitive, Internet of Things, and many of the emerging technology disruptors.
Excellent. So tell us a little bit, what has you most excited about artificial intelligence applications in healthcare?
Yeah, no, sure, absolutely. I think, there's kind of various applications that one can think of, but perhaps the most exciting ones are the application of artificial intelligence from a robotic surgery perspective,
okay.
Computer-aided design, and not design, but essentially kind of diagnosis, particularly as it relates to, I would say, ability to read radiological imaging and be able to essentially kind of make a diagnosis, and at the same time, I would say, reduce false positive and the typical errors that one sees. In a nutshell, if I can sort of capture it, yeah. I would basically say the shift and the pivot from what I would call experience-based medicine to evidence-based medicine that is enabled by data, analytics, and more by cognitive computing and artificial intelligence.
So as the big data era of healthcare gets underway, what are your clients asking you about protection in terms of security for patient data or security for hospital data, things like that? How is security and privacy factoring into this conversation?
Yeah, now it is definitely a huge concern.
Right.
And while that has always been a concern, and that's why we have had kind of regulations as it relates to HIPAA and the various kind of ways of, I would say, managing and dealing with personally identifiable information and personal healthcare information, I would say that it's become a bigger concern because with more and more patients essentially being able to now kind of contribute their genomic data,
yes.
and genomic data kind of entering the picture as it relates to kind of research, it's incredibly hard to basically mask genomic data. And it's not kind of that easy in terms of basically de-identifying genomic data. Technically, you can actually identify a patient by his or her basically genomic sequencing, essentially. So there are various ways that are being thought of, but to be honest, I don't think that there's kind of one particular sort of protocol that has been decided in terms of how to manage and how to basically protect all the data that is out there right now.
What's the opportunity for artificial intelligence and deep learning? Like, what problems can we leverage that to solve here in healthcare today?
Yeah, so I would say that the biggest impact ought to be at the point of care, particularly as it relates to being an aid to a physician, as it relates to the diagnosis, the treatment protocols, and how to basically, I would say, personalize the care protocol for a population of one.
Okay.
Meaning that instead of basically using tried and true methods based on experience, as it relates to this is how medicine has been practiced, literally analyzing the underlying data, understanding not only the clinical but the genomic and the lifestyle and the physiological characteristics of the patient, and customizing or personalizing the treatment protocol for that individual patient. That's probably where I think the biggest impact is going to be with the application of many of these disruptors, and particularly artificial intelligence and cognitive computing.
Wonderful. Well, thank you so much for joining us and for contributing your perspective. I know artificial intelligence has been one of the hot topics here, especially how we're using big data to drive further innovation into the healthcare system. Thank you so much, Nittin, for joining us. This is Jessica DeMassa reporting from the Guidewell Insights Lounge here at Singularity University's Exponential Medicine.
Thank you.